Welcome to the press briefing on the updates of COVID-19 cases. Let me introduce the speakers today. In the middle, Dr. Choi Chak-yi, Undersecretary for Food and Health. Dr. Chung Shuk-kwon, Head of Communicable Disease Branch for Center for Health Protection of Department of Health, and Dr. Lau Ka-hin, Chief Manager, Quality and Standards of Hospital Authority. The Undersecretary will give his opening remarks. Good afternoon, friends of the media and fellow citizens. As of yesterday, February 23rd, the number of positive cases in the fifth wave have surged to over 60,000 cases. According to statistics from the Hong Kong U School of Public Health, the effective reproductive number on 16th of February was 3.3, which means for every one case, it could give rise to 3.3 new cases. In other words, the epidemic is still very severe and the spread shows no sign of abating. And for this, the existing social distancing measures have been extended 14 days from today to the 9th of March. At the same time, we are further tightening some social distancing measures, which include only 2 diners per table in all restaurants. 2 must wear a mask in any part of a country park. And 3, when engaging in physical activities outdoors, including exercising, you must wear a mask. And 4, no mask removal for food and drinks on public transport, including kaitos and ferries, and in paid areas of the MTR. Another measure is to fully implement the vaccine pass, CAP 599L, the Prevention of Control of Disease Vaccine Pass regulation was gazetted on Monday, which stipulates from today onwards that all persons aged 12 or above when entering or in any catering establishment must at least receive 1 dose of COVID-19 in restaurants or in designated scheduled premises. According to CAP 599L, restaurants including 20 types of premises are subjected to active checking. Besides the staff in these premises, the person in charge of the premises must use the QR code verification mobile app, must scan the vaccination record and the QR code of the COVID-19 vaccination medical examination certificate for those entering or in these premises. If the vaccination record or the exemption certificate does not include a QR code, or he or she is an accompanied minor under 12-year-old, the person in charge will demand the patron to fill in a form and provide contact details. Currently, only 4 types of premises are subjected to passive checking, such as shopping centers, department stores, markets, or bazaars or supermarkets. Those entering the above premises must carry with them at all times the COVID-19 vaccination record or exemption certificate for inspection by authorized law enforcement officer upon request. For the person in charge, and for the active checking and the passive checking premises, they must display a notice in every entrance or at a prominent location in a specified form to inform people and preparing to enter that this is a vaccine pass applicable premise. And that's what a notice looks like, and this is an active checking premise notice, and that's what a passive checking premise notice will look like as well. I would like to remind for both person in charge and customers, any breaches will result in penalties. Upon conviction, the person in charge can be fined $50,000 or 6 months and 6 months imprisonment. And when a visitor is breaching the regulation, they will be issued a fixed penalty ticket of $5,000 or higher. Eligible citizens, including the seniors, children, and pregnant women, should get vaccinated or get a booster as soon as possible. In order to reduce the likelihood of severe symptoms and death, the government has approved the Sinovac vaccine to remove pregnancy and lactation period from a list of contraindications on its product manual. And the Hong Kong College of Obstetrician and Gynecologists guidelines point out that if a pregnant woman is infected with COVID-19, the consequence will be more severe than non-pregnant women. And if a pregnant woman is infected, they will add to the risk of perinatal mortality and premature birth. Dear citizens, we're now in a very critical phase, and we will do our utmost and expeditiously control the epidemic. We should avoid cross-family gathering and put our minds together to fight the virus, and in order to defeat the virus.
Dr. Chang will update us on the latest situation. Good afternoon. As of yesterday, we had 8,798 confirmed cases, from 752,255 to 84052. 4,212 confirmed by HA directly. 4,586 cases confirmed by our lab, the CHP. Confirmed or reconfirmed by the CHP. Among the 4,586 confirmed cases, 19 had LC485R strain. 4,334 was suspected to be Omicron. 130 cases because of low volume of virus. It cannot be analyzed, and 3 cases have yet to be analyzed. Reported cases yesterday, 12,290. Among the 8,000 odd cases, 3 of them were imported. The rest are local cases. As of yesterday, about 360 institutions had cases with residents or staff affected. More than 420 inmates, 420 staff and 1,100 inmates had prelim positive or confirmed positive results. 37 institutions had more than 10 cases. So much for me for today. Dr. Lau, would you please brief us on the situation of the hospitals? Good afternoon. There are 4,642 confirmed patients in our public hospital. In Northland Tower Hospital, the Infectious Disease Center, the AWE Community Treatment Facilities. About 1,300 odd patients in Penny's Bay Isolation Facility. About 350 or so in the community isolation facility in Chin Wan Dorset Hotel. Last night, 33 cases were critical, and 49 cases were serious. As of 00 this morning, in the past 24 hours, 50 patients infected with COVID-19 passed away. 35 male and 15 female, aged between 52 to 97. Among these 50 patients passed away, only 6 had 2 doses of vaccines, and 2 patients had 1 vaccine dose of vaccine. So altogether, 8 patients had 1 to 2 doses of vaccine. As for the age distribution of patients, those less than 60 or equal, 5. The remaining 45 more than 60 years old, and 31 of them more than 81 years old. As for the younger, they are less than 60. One male, 52 years old. He lived in a RCHE, and he was immobile. He was unable to communicate. Starting from 2018, he had problems with his brain, had brain surgery. He was chronically ill. A male, 53, another male, age 53. He had cancer, spread to different organs. Another male, age 56, live in a RCHE. He had brain deterioration. Situation was poor. Another male, age 58. He had immuno problems, arthritis, and he was on medication, and the medication caused him a reduction of immunity. And he had stroke a few years ago. He was also chronically ill. And finally, a female, age 60, had a brain tumor, and she was receiving chemo. And so she was susceptible to infection. Now, since the data had some time lapse, I'd like to report on the 21st and 22nd of February, another 17 patients passed away. Among them, 15 male, 2 females, age between up to 93. Altogether, 255 patients passed away in the 5th wave. Most of them are elderly. In 2 years' time, 460 patients passed away in public hospitals. This morning, a 9-year-old boy had a coma at home, and his family members called the ambulance, and he was sent to A&E department of United Christian Hospital. The situation was very bad. There was no heartbeats, and he was unable to breathe, and he was on resuscitation. He was chronically ill. Pediatricians were called, and he was provided with resuscitation, but unfortunately, the boy passed away in the morning at 7:07. The case has been handed over to the coroner. The boy didn't have any vaccination against COVID. Because of his sudden death, when he was admitted, we took some samples for COVID testing and confirmed that he was positive. The case will be included in the death report tomorrow. And yesterday, another 257 patients were discharged. In the public hospital, the usage rate of isolated beds, 92%, far exceeding the capacity of the isolation wards. Yesterday, through admission screening and in-house screening, we identified another 10 patients confirmed COVID positive. Patients living in the same wards, about 30 of them, were regarded as close contacts. As of staff members, up till now, 1,608, 68 staff confirmed COVID positive. As for Tinshui Hospital, starting from 26th of February, the whole hospital, 300 beds, will be converted to admit COVID-19 patients. That is to pull all our efforts together to care for patients. The A&E department of the hospital will provide service, and emergency vehicles will only send patients to the A&E department, and they have COVID will send to A&E department, and the other kinds of patients will send to Tuen Mun Hospital. Services will not be affected. Patients now in that hospital will be transferred gradually to other hospitals, and special clinics will still provide service, and patients will be prescribed with medicine. As for those who are provided with dialysis, they will be transferred to other hospital, and there will also be consultation online for other patients. I will inform the patients of the arrangement. Tinshui Hospital has also marked out the routing for COVID patients to enter and leave the hospital so as not to overlap with the movement of patients going to the specialist clinics and the general outpatient clinics. and will provide adequate PPE to our staff, and will provide anti-infection measures and training for our staff members. Let me give you another plea, make another plea. There are many patients calling on Kwong Wai Hospital and QEH. Patients have to wait for a very long time in order to be treated. Fire Services has informed us that in the past few days, not just as of yesterday, they received call for ambulance service. More than 30% of them were COVID patients with no symptom or little symptom. The overall serious delay reached 358 cases. The situation is very serious. As for our, people tested positive by RAT should conduct further tests by deep throat saliva test. And for those who have mild symptoms or no symptom, they should wait at home patiently. And let me urge patients once again that they should not call ambulance to bring them to A&E department of hospitals so as not to increase the pressure on A&E department. And we have also 9 designated clinics for confirmed COVID patients with moderate symptoms. And confirmed patients with other medical issues can call our support hotline. That is 1-836-115. And finally, on our cooperation with private hospitals on admitting patients.
The Baptist Hospital will allocate 12 beds to help receive patients from public hospitals. First, we'll arrange the patients with the Kowloon Central Cluster. And we are now talking with different public hospitals on different cooperation. I believe that there will be other announcements to be made soon, and that's all from me. Thank you, Dr. Lau. It's now the open the floor for questions, and please speak through the microphone and state the media you represent before you speak. This lady. Ming Pao. First, I'd like to follow up on the boy who passed away. What symptoms did he show? Had he visited a doctor or tested? What chronic condition did he have? And what was the preliminary diagnosis? Was he died from COVID or from his chronic condition? And according to the anti-COVID-19 staff bulletin and the doctor's interview, that the confirmed HA employee that for the 7 days from the positive confirmation, and as long as they're tested negative on the 7 days after rapid testing, they can return to work. And when people make inquiries to see that if he is in breach of the statutory requirement, but he did not get any answers. Why do you have such arrangements? And by law, are you requiring the staff to return to work after 7 days? And is it actually legal? Just now, Dr. Lau mentioned that the Queen Elizabeth at Kwong Wai Hospital have lots of patients waiting at the AED. We heard that there are a huge crowd in the QEH, and some of the patients have been waiting for 7 days at the AED department before being sent to the wards. Is it true? Some of the staff were infected during work, which contribute to this scene. Dr. Lau? I would like to elaborate more on the 9-year-old boy. At the age of 2 or 3, he has a genetic condition, and he was confirmed to have some hereditary muscular disease. All of a sudden, he passed out at home, and his family immediately performed a first aid and called an ambulance, and the ambulance performed CPR on him and sent to the United Christian Hospital A department. At the A&E, we called our pediatrician to perform resuscitation on him. Unfortunately, the boy passed away. We know that before admission, checking his medical history, no major disease was noted, and for a sudden passing, we tested him for COVID-19 and came back positive. Therefore, he is an infected case. As for the cause of death, and since his passing was so sudden and was just a matter of hours, therefore we referred this case to the coroner's court for further examination. Was it because of his chronic illness, or he was affected by COVID? We need to conduct further tests and examination. As for the arrangement for our staff, I think the public do understand that the COVID-19 situation is severe and our staff are infected as well. As of today, we have 1,668 staff infected with COVID-19. And some of our staff family members are confirmed cases as well, which made them close contacts. And this will affect our frontline manpower. While everyone is contributing in taking care of the COVID patients, if we can balance the risk of infection and hospital operation needs, at these extreme times, we hope to implement some arrangements to ensure we have adequate manpower to provide the necessary medical services. That for the confirmed staff cases, from the day of sampling to the 7th day, that means the day that PCR test was done. If the report came back positive, that we call it day 0, and we count 7 days. If they take an RAT on the 7th day and came back negative, he or she can inform his or her superior that he or she had done the RAT test and came back negative, and stated his circumstances. Let's say he or she has recovered and is in good health. There's a person in charge who will arrange them to return to their posts. And for staff classified as close contacts, well, since he or she is a close contact, they will need to stay at home for quarantine, and they need to inform the person in charge in his or her department. From the day of notification that he is a close contact, from the 7th day onwards, he or she will do another RT test. If it came back negative, he or she can inform his department in charge for returning to work. The expert has analyzed, and we have considered most of our staff. Actually, 98% of our staff are vaccinated. Our infectious control experts had made reference to overseas and local data. and most of the patients by the 7th day, there is no lab trace of the virus. If they test negative on the 7th day through RAT, there should be no detectable virus load. Therefore, we deem them as safe. On this suggestion, proposal, we've consulted the CHP, and they agreed the lifting of the quarantine. First, we need to communicate with the staff on when he or she become infected or become a close contact, that his boss definitely will know, as they will be absent from work for the whole period. On the 7th day, they will take the test, and the person in charge will inform the HR department, and the HR department will communicate with the headquarters and will liaise with the CHP so that the quarantine order or the isolation order to be lifted. Then our staff can return to their posts to take care of the patients. Well, some may doubt that when they return to posts, will there be a risk of infection? A lot of the foreign data have shown that by the 7th day, there will be unlikely to be any live virus load. Acting out of caution, we will tell our staff to strictly adhere to our infection guidelines. For example, on each day, they must take an RAT test, and we also wear the mask properly to ensure that there's a good fit with this mask, and must adhere to the instructions of the hospital infection team by wearing the right personal protection equipment. And also, keeping up hand hygiene, no meal gatherings, and wherever possible, they should dine alone and maintain social distance. I would like to take this opportunity to thank our colleague that at this time, and everyone is doing their bit. Every staff counts. I would like to thank their cooperation and remain steadfast to their posts. Speaking on the mic. Speaking on the mic. Please wait.
I don't have information in hand. Give me some time to check. Next question. The gentleman in blue. Yes, I'm from Phoenix TV. Good afternoon. This morning, the hospital authority urged people not to call upon QEH and Kwangwa. In the afternoon, many A&E departments had long waiting hours, more than 8 hours. How can the authorities improve the situation? Another question is on the medical and healthcare staff members who have to conduct RAT if they go back to work. Is it also necessary for all the staff members to take RAT before they start working? Well, everybody is worried if they feel unwell, if they are nervous, they want to have medical help. The A&E department has become the easy access to get medical help. In the past few days, in particular at QEH, the workload of QEH shot up. Some, as I said earlier, some had moderate or even no symptoms, and they went to the A&E department. And that increased the workload, the visits, number of visits of the A&E department. Those who need care will have to wait because there are more callers. Each patient may have to wait longer in order to be attended to. Apart from COVID patients, there are also other patients who are in an emergency condition. For those who have mild symptoms, they should stay at home and wait for the isolation facilities if they are waiting. In fact, there are 9 designated clinics by appointment by phone. You can go to visit the doctors there and be treated and be prescribed with medicine. They don't need patients don't need to go to any departments to wait. I hope you understand that there are many patients waiting, and you will have to wait for a longer time. And please do not then put it on all our staff members. All HA staff members, including those in the front line, in particular those in the front line, they will have to conduct a RAT before they start work to confirm that they are not carrying any virus. The spread in the community of COVID-19 is widespread, and if our colleagues have been infected, we hope that they can be identified early, and we can also isolate our colleagues so that they will not spread the illness to other colleagues or patients. And the next question, the gentleman in suit. I'm from TVB. I want to follow up on a case of a 9-year-old boy. This morning, before the incident, had he any checking or examination, medical examination or tests, and had he been found positive? Another question is in relation to the suggestion of Professor Gabriel Leung. He suggested to increase the vaccination rate of children as soon as possible. Will you therefore consider providing more vaccination points for children? As for relaxation on the mechanism against airlines, so that more people, more Hong Kong people staying overseas can return to Hong Kong, what will be the arrangement? As for the vaccination program, we are very anxious about more vaccination. We see that the vaccination rate of elderly people, in particular in RCHEs, and also vaccination rate of children are low, and we will spend all of it, try various means and channels to facilitate and increase the provision of vaccination to our target groups. As for children, we will increase the number of vaccination points, and we reduce the age eligibility to 3 years old. And for some schools, if they can organize a group of children to receive vaccination, then we will send our outreach team to help. As for arrangements for airlines, the government has a policy, and that is we prevent import of the disease from overseas. And depending on the development of the pandemic, we adjust our measures in respect of flight arrangements. Whether it is based on flight or based on country, we have arrangements. And during the 5th wave, in the early phase of the 5th wave, we monitored the situation, and we felt that we should take more resolute measures in preventing import of the pandemic, and therefore we have made arrangements to stop the flights from some countries. According to record, the patient last night felt tired and had bad appetite, but there was no symptom of upper respiratory tract infection no cramp, no fever, and he didn't have any record of having contacted COVID patients. He didn't have any screening for COVID before admission. When his situation, conditions deteriorated, he was provided with first aid, and then when he was brought into hospital, pediatricians were called to provide resuscitation. He had a hereditary disease. He was chronically ill. Unfortunately, he passed away this morning. Sorry, speaker's not coming through. Speaker's not coming through. He's not using the microphone. You refer to the patient in Yan Chai Hospital? Well, I don't have much information. Perhaps I can touch on that. A 4-year-old boy last night had fever and cramp, and then he was in a coma. Their family members called the ambulance, and about 1 a.m. The boy was brought to A&E department, Yan Chai Hospital. We were told that at home, the boy had RAT tests positive. Of course, we would take a sample and conduct a PCR test. The result is not available yet. As for the boy, upon admission, at that time he was stable. The 4-year-old boy, he didn't have any vaccination record. Let me urge you once again, children 3 to 12, elderly people have low vaccination rates. Please take this opportunity to be vaccinated. If you don't have the first dose, try to have the first dose as soon as possible. If you have the first dose, try to have the second and third dose. Next question, the one in front.
Thank you, doctors. I'm from Bloomberg News. My first question is on the series of children's cases that we've seen in recent weeks. Given that the earliest of them have been sent to the coroners, have we any updates? Because we still seeing new cases, and I think parents are probably waiting for an answer on exactly what's happening to these children and what specific symptoms that they should watch out for, especially if it's related to COVID. And my second question is about mass testing. We're just days away from March, and I think the public still haven't had any answers about how the mass testing is going to unfold. Chief Executive Carrie Lam said that the Food and Health Department is being tasked with running the mass testing. So I was wondering if there's been any updates on the planning of the mass testing. Exactly when is it going to start? How exactly it's going to work? And there's been concerns of family separation of children who may be tested positive during the mass testing, but not their parents, so they could be separated if the children are sent to isolation. And also, I think the planned isolation capacity at the moment is somewhere around 50,000 rooms coming from hotels, as well as new isolation facilities being constructed. But Professor Lau Yulong has estimated that as many as 300,000 cases could be discovered during the mass testing. So what exactly do government departments plan to do for the overcapacity if that happens during the mass testing? Thank you.
Yeah, about the compulsory universal testing exercise that the Chief Executive has announced just a couple of days ago, we understand that is a very colossal exercise because it involves the entire population of Hong Kong. So as the Chief Executive pointed out, she has appointed a secretary to task to take the lead on this massive project. And as you can imagine, the logistics of ensuring smooth operation of the entire exercise need very detailed preparation, just in terms of the logistics of making sure all those who are required to have the test done will be tested. And they are tested not only once, but more than once, and the arrangement in between. Apart from that, we also need to prepare all the possible sequential actions that need to be taken. For example, as you have mentioned, the capacity to address those who are found to be positive by these exercise. As of now, we already have had different bottlenecks in terms of testing, confirmation, isolation, quarantine. So we are well aware of the challenge in preparing sufficient capacity to cater for the need of those found to be positive by this massive exercise. So working very hard on this. Thank you.
Under the current practice for the pediatric patients test positive to the COVID-19, if the accompanying parents or caregivers are also confirmed as having COVID-19 and capable of taking care of the young patients, the hospital will try to facilitate and arrange them to stay in the same ward if situation allows. Considering that the parents, if not test positive, it is not advisable to stay in the hospital's isolation facilities. However, we understand that the stress of the parents of not being able to accompany their child, therefore video call would be arranged up to a few times a day. The hospital hopes the patient's family members can understand the limitations of the arrangement and the space constraint under the current epidemic situation. Our clinical team, our doctors, nurses, are trying their best to reserve as many beds as possible for the needy children. Of course, the above arrangement will be reviewed from time to time according to the latest situation of the rapidly changing COVID situation.
好，下一題有冇其他英文問題？
Next question, any other English questions?
So for the 9-year-old from SCMP, so for the 9-year-old boy who passed away, who tested positive after passing away, did he suffer from brain inflammation? And can you further talk about his situation? And also, as there are now 3 young children who died of COVID-19 in the 5th wave, do you think it is an unusually high number compared to the rest of the world or compared to the previous waves? And for HA, is it still possible to transfer manpower from public hospital to operate the new temporary hospitals being built in the future? Thank you.
For the 9-year-old boy, he is suffering from a genetic disease. That means he is suffering from a long-term chronic illness. And he was found to be unconscious at home last night. And then his parents started the resuscitation, and the parents called the ambulance, and the patient was sent to the accident and emergency department of United Christian Hospital. The parents told us that patient has some tiredness, malaise, and degrees in appetite last night, but there was no other upper respiratory tract infection symptoms, no fever, no convulsion, and the patient was not tested any COVID before the admission. Since the patient died very shortly after being transferred to the accident and emergency department, we have tested the patient for the COVID-19 status. Finally, the results was positive. Due to the very short period of death time between the patients at home and in the emergency department, the patient was referred to the coroner for further investigation. Yes, we are facing a huge demand of service in our medical care, including providing the service to the COVID-19 patient as well as the other patients. We are still caring the other patients, including the patients with cardiac disease, stroke, or other illness, or in the accident, car accident, etc. We have asked our staff to work more by providing some allowance to them, but you know we are human. We are stretched. We hope we have other help from any other sources, including our doctors and nursing in the private sectors. That's why we have discussed with the private hospital to arrange more beds for our patients, as well as to arrange more programs to facilitate the transferal, the caring of the at this moment non-COVID patient to them, in order to save more power and manpower to tackle the COVID patients as well as the emergency patients.
好，下一題啊。
Next question. The lady in this vest. CGTN. I think just the Chinese medicine can help the mild patients to recover, and some of the doctors to help to do teleconsultations for the patients. What is the government's view of the Chinese medicine practitioners in joining the anti-epidemic methods, and what measure is in place? And what is the situation of the mainland medical delegations, and how can they demonstrate their contributions in fighting the epidemic? The Hong Kong's government has long waited attached importance of the Chinese medicine practitioners at the policy and the resource level. We have been providing more support to the Chinese medicine practitioners. During the COVID, we noticed that at the mainland, the National Health Commission, their COVID-19 treatment package mentions medical observation and light symptoms, and to use some Chinese medicine to treat patients of different conditions. Therefore, we'd like to thank the support of the central government and the support of the Chinese medicine sector for their donations of the Chinese proprietary medicine to the Hong Kong public. The government will announce later how it will be distributed to the patients in need.
The Secretary for Food and Health has met with representatives of the Chinese medical representatives on the use of Chinese medicine. Say, for example, in the isolation facility of Penny's Bay, there is also consultation by Chinese medical practitioners. You can see from the media reporting that different kinds of support are given by the central authorities to Hong Kong, including testing personnel, testing equipment, and then provision of medical materials, provision of a stable supply of food and other materials to Hong Kong. In terms of prevention of the pandemic, the epidemiological experts and other medical experts have come to Hong Kong and give their advice to us. The central government is helping us on various fronts, and we thank the central government for that. The next question from cable TV concerning the days for a period of isolation for HA staff. You refer to 7 days. Why non-HA staff have to be isolated for 14 days, whereas HA staff has to be isolated only for 7 days. This is unfair. For ordinary citizens, actually, do they need to wait for 14 days before they can be released into the community? As for the RAT test, Dr. Choi referred to RAT tests for staff members every day. The government says that RAT tests cannot be a substitute for PCR tests, why RAT tests can be a substitute for HA staff. Now, some patients have been moved indoors to wait for A&E department service, but they are not in the negative pressure rooms. So are there adequate negative pressure beds in the hospital? As for Mira Place, a dozen of people have been tested positive. Works have not stopped. So is there a gap in terms of preventing the pandemic? As I said, we have 1,600 odd staff members confirmed to have got COVID. And some of their family members are also confirmed COVID patients, and therefore they become close contacts. Our staff members are very important for caring for our patients. Every staff member who can care for our patients should be put on duty so as to care for our patients as much as possible. Now, our decision is justified because we are advised by epidemiological experts and other experts, and we also make reference for clinical data, both local and overseas. Now, after 7 days, after 7 days of the onset, the majority of the virus found were not active. About 97 or 98% of our staff have been vaccinated. We hope that on the 7th day, if they are tested negative, they can then inform their officer in charge. And our colleagues really want to go back and help out. They have their colleagues still working, going the extra mile to help. So the staff members who have been isolated, they really want to go back and care for the patients. And therefore, we have discussed with the CHP. Our staff members are not ordinary citizens. When they come back, they have to be tested every day. And they have to strictly comply with control measures, infection control measures. And when we implement control measures, we are very strict in terms of compliance. We hope that our colleagues, after isolation for 7 days, having got a negative test result, will come back as soon as possible to care for our patients. As for non-negative pressure wards, there are 4,600 odd patients in public hospitals, in North Lantau, in AWE facilities. We told you that we had only 3,000 odd negative pressure beds, including the second-line wards. So there are patients who are in non-negative pressure wards, and many patients are waiting for admission. For those who do not need to be admitted into hospitals, they are placed in isolated facilities, say in Penny's Bay and in the isolation hotels. But there are still patients who have to be admitted, and we need to care for them. Therefore, we need to convert the wards. We add ventilation fans. We ask our infection control experts to give advice to us. They advise us on how to place the beds, how to make arrangements for the patients to achieve good infection control. Infection control is not just limited to negative pressure wards. Infection control includes many factors. We need to have certain spatial arrangements, where to put the patients, how to use PPE by our colleagues, by staff members, and also by patients, the workflow, ventilation, so on and so forth. They are all based on the advice of infection control experts. I hope you understand that in the current situation, we are not able to do as much as we had during the first and second wave. At that time, we had more facilities and more resources available. Now we have to save lives. We have to have adequate healthcare staff to care for our patients. Of course, we will not ignore infection control, but that's not the case. Otherwise, we wouldn't have asked our colleagues to conduct RATs every day. We remind them from all the time to put on PPE appropriately, not to gather together, not to remove masks, not to eat together with colleagues. All these measures are to prevent infection. Preventing infection is important, very important, but the point is we need to increase our capacity to care for our patients. Sorry, speaker is not coming through. She's not using the microphone. Now you have to consider that we have 80,000 odd staff members. It's impossible to ask them to conduct PCR every day. RAT is rather accurate. If they have a RAT positive, they will have to report to the OIC, and then we will make arrangements for them to receive PCR tests as soon as possible. We don't just leave it there. We have a whole scheme. After RAT, having got the result, then there will be follow-up. Now, concerning vaccination, for those who have been vaccinated, after 7 days, basically the virus load will be very low. So basically, people need not to wait for 14 days of isolation. Let me answer the question.
Let me answer this. This is a special arrangement agreed by the Department of Health. The HA will ensure that the employees will stick to the infection control measures and daily testing. For the general public, we are still asking for 14 days of home quarantine. Anything to say about the Mary Place? Nothing to it. All these locations, either around you or your workplaces, you will find many cases around. In the community, there are lots of cases. Therefore, employees should monitor their company and their work environment. If there are lots of cases, they should arrange, well, first, even without cases, they should arrange their staff to work from home. If there is an outbreak, especially for many cases, they should arrange a cleansing and work from home. Last two questions. The gentleman at the back. In media. A question for Undersecretary. The IXCO yesterday approved the exemption from statutory requirements, allowing the mainland experts to Hong Kong. And for the community isolation facility, upon completion, will there be enough local healthcare personnel to take part? A question for the Department of Health on the Mary Place. Over 20 security guards and cleansing staff tested positive from RAT, and the management claimed there are just 7 confirmed cases. Can the RAT be treated as a proof of infection? if the shopping mall continues to open, and while those quick tested positive stay at work, will you advise the shopping center to be closed?
咁關於即係今日我哋政府出咗一個嘅即係通告啦，就係
The government issued a notice
知道即係今日有一個
that from today onwards,
緊急情況規例條例第241章。
that under Cap 241, the emergency regulation ordinance, that the government enacted the emergency bracket exemption from statutory requirements bracket COVID-19 regulations. I would like to give you some background. The fifth wave is very severe. As you can see, there are sharp rising cases, and this wave led to a lot of service bottlenecks, which is well known. For example, in testing and isolation and quarantine facilities, that we are seeing a lot of bottlenecks. And a lot of the questions just now had to do with insufficient facilities. It demonstrated that our capacity is running out and we cannot handle it alone. Therefore, the government have made requests to the central government for assistance so that we can put the surging epidemic under control. In this situation, we need to consider different options to remove any administrative bottlenecks. For the hardware, we can build some facilities or import some equipment or any anti-epidemic supplies. Well, there might be some legal obstacles. Well, I understand the legislative intent of these legislations in these urgent situation in order to make available of these resources. We see that it's necessary to remove such legal obstacles. The notice clearly stated that and authorized the Chief Secretary that in order to treat a stipulated disease, which is the COVID-19, to allow personnel and facility and resources that to exempt them from licensing, registration, or an application, so that not have to comply with certain requirements like license, authority, approval, exemption, so that the resources can arrive to Hong Kong as quickly as possible in order to prevent, protect against, and delay or controlling the transmission of specified disease. Last question. AM730. We'd like to ask about the social distancing measures. Could the salon be opening soon? Well, with any health problems due to lack of a haircut. For those quarantined at home, if they're unvaccinated, they will need to have health proof to enter these scheduled premises. And do you have any interim measure in place? And Dr. Lau, just now you mentioned about the belated death figures. You claimed there were 17. However, this figure doesn't add up. Can you confirm the number and the breakdowns? And for the HA staff, and can they stay at home if they tested a negative on the 7th day? And will be arranged to take care of confirmed cases or COVID-related work? And there's some clips circulating about the Penny Bay facility that some of the quarantinees were unsatisfied with the arrangement. Do the administration know what's going on and how do you plan to handle it? And Dr. Lau is a psychiatrist yourself. And for those who have been quarantined or isolated many days, and any way to relieve the stress so they can be less nervous. And for the social distancing measures, that from now until April, that the premises ordered to close will not be open. We will only tighten. For example, we are actually tightening the use of masks. The closure of this premises is because at such critical period, we don't want people to gather and do all kinds of things indoors. This all should be stopped. But in the penny-based isolation facility, they need to deal with large number of people and all the registration and allocation and the tests. They have all standard operating procedures. If there are some problems, they will affect the operations. I believe that the departments will make improvements on them. I don't quite understand your question on home quarantine. For the recovered but unvaccinated patients, they will be given an exemption certificate. However, the vaccine pass mandated them to have at least one jab. How can they get the proof to enter such premises and they're not suitable to get the first dose for the time being? I don't quite get your question. Maybe Dr. Lau can answer his part of the question. Maybe I didn't make myself clear. For the time-lagged figures on 21 and 22nd, there will be 15 male and 12 male and 5 female. The age distribution, 60 to 84, 80 or above, 13. The HA at Penny Bay is responsible for manning the medical stations to provide medical support for them. And in view of the rising demand for the hotline, the HA will boost the phone system capacity and add more manpower. If the patients have any medical needs, they can declare it by clicking on the QR code and notify the medical personnel that they need support. For the recovered patients, and within a short time after recovery, they could not get vaccinated for the time being. However, currently do not have proof to enter the premises. The website have outlined the arrangements for recovered patients. They do not need to have the grace period for 6 months. They do not have such proof, and therefore they can't show proof that they are exempted. I may not able to give you a full answer. For the passive check-in premises, and they can enter this premises when authorized officers ask them, and they can give a reasonable explanation. For the details, we can supplement after the meeting. And thank you. For this strict social distancing measures, the intent is to prevent unnecessary occasions to engage in different activities. This is a public health matter. And that's the end of the press briefing. Thank you. Only one in 21st. The rest were 22nd.